Welcome to session one, evidence for impact of climate change on the pediatric respiratory system. Our first speaker is Dr. John Balmes, who is currently the director of the Northern California Center for Occupational and Environmental Health, as well as a UC Berkeley UCSF joint medical program. And he will be speaking on how climate change is impacting children's lung development.
Well, thank you. I was the guy who came down from Berkeley, but yesterday I came back from Kenya. So if I fall asleep in the middle of this talk, you'll understand. And I want to thank David for a very nice introduction, especially for mentioning Abe Rudolph, who was a giant in child physiology, especially with regard to the cardiovascular system. And just to mention, his daughter, Linda Rudolph, at the Public Health Institute, is a major advocate for doing something about the impacts of climate on health. So my task is to talk about how climate change is impacting children's lung development. And David really spent a few slides outlining that, contextualizing that nicely. So I don't have to convince this audience about the importance of climate change, but just to remind folks that there are effects on heat waves, to cause heat waves, wildland fire, which have now impacted the East Coast. So they now understand a little bit about what we go through almost every fire season lately. Storms, again, California was hit really hard this winter. We had, more rain and wind and storms than we've had for a number of years. And I won't talk about this, but I think other speakers will. There's an increased risk of allergic responses because of change in growing season. And I'm going to focus on the effects of climate change on air pollution. And I got this slide a few years ago from the American Lung Association, and I really like it because it covers sort of all of the major drivers of poor respiratory health, and these are going to affect adults as well as kids. And I'll be talking about ozone, particulate pollution emissions, wildfires, and a little bit about vulnerable populations. There'll be more about that later. And so just to remind everybody that the major man-made sources of greenhouse gases and aerosols contribute to both poor air quality and climate change. So if we transform our economy and get away from burning fossil fuels, we'll be having co-benefits both for health and the environment. Now, David showed similar slides with regard to lung development. And here I'm talking about measuring lung development by lung function. David showed how alveolarization of the lung doesn't stop at birth. It continues on. And there are effects on both the alveoli and the airways during early childhood. And there are multiple factors that impact. So I'm not trying to say that air pollution is the one hazard that we most have to worry about, but it is definitely a contributor. And it isn't really till early adulthood that there's maturing of lung growth. And I'm not going to talk too much about the evidence for this, but there's increasing evidence that both during pregnancy, when the mother is exposed and the fetus indirectly, and early childhood may be the most critical times for effects on lung growth, both positive ones, perhaps by good diet in malnourished populations, and then negative ones due to air pollution and smoking. So I've studied ozone for multiple decades. It is the pollutant that has the most research behind it. It's a prototypic oxidant that directly injures, depending on the concentration inhaled, directly injures the airways, especially the very small airways right before the alveoli, the respiratory bronchioles. And the major source is motor vehicle emissions. and it actually is highest in concentration during sunny afternoons, because really the emissions from rush hour, both oxides of nitrogen and volatile organic compounds, emitted during the morning, and then they're cooked in the sunny afternoon to increase ozone concentrations, which this slide shows. Just to remind everybody, the ozone levels were so bad due to smog in LA that there was a bipartisan agreement when Ronald Reagan was governor here in California to do something about that. And the agency that I'm the physician member of the board, the California Air Resources Board, was chartered in 1967 with Ronald Reagan signing a bill that had major support from both parties. A little bit different now. So these are data from Fresno, where I do a lot of air pollution research. I'm an adult pulmonologist, but I often study children. They're a lot easier to study than adults most of the time. And so ozone directly increases with higher temperature. So these aren't projections. These are data from 2011 showing that as the temperature gets warmer, there's more ozone. So we're going to see more ozone with climate change around the world, not just in California. So what do we know about ozone and the growth of lung function? So there are several studies which have shown reduced growth of lung function with cumulative ozone exposure in childhood, but not all. I could have shown you a study that I conducted with my colleagues Ira Tager and Nina Holland in the 90s, where we showed that kids who grew up in Southern California with greater lifetime cumulative ozone exposure than kids who grew up in Northern California, where we have less ozone. And there were effects on the smallest airways in the lungs, the smallest ones we can measure with lung function. But I don't have as nice slides from that study, so I'm going to show you one from Mexico City, where it's admittedly at higher ozone concentration. But there are studies in rhesus monkeys from UC Davis, from the Primate Center there, multiple studies that showed adverse effects of early life ozone exposure on lung development, especially when there was co-exposure to allergens. So they had this model where they would cause allergic airway disease, basically asthma, because rhesus monkeys have essentially the same lungs as humans. I don't know if everybody knows, but do you know how much DNA homology there is between us and rhesus monkeys? 99%. So they have the same lungs as us, pretty much. And a rhesus monkey development is pretty much done by age 3 years. Anyway, they showed if they did co-exposure to ozone and allergen, that they would actually affect the lung development. There would be less branching of small airways. And this is a study was done in Mexico City in the early 2000s. Mexico City has some of the worst ozone concentrations in the world. And this slide is basically showing a nice linear relationship in both boys and girls between ozone concentration and lung development, forced vital capacity on this slide. And so, it's not dramatic, but this is showing 25th percentile, 50th percentile, and 70th percentile of ozone concentration. And you can see with the 75th percentile, highest ozone have the lowest development of FVC. And just to remind you, this is for the whole group, the whole population. There are individual kids that would have much greater impact. So again, thinking about the most susceptible kids, a kid with asthma is going to have the effect of asthma on lung growth combined with the effect of ozone. So I know there are people from outside of California on the Zoom, but in California, we're quite aware about extreme heat days. And this slide is just showing projection in terms of how many days would be above 105. We get some of those now, but by another 20 years, they'll be almost a month, a year of those extreme hot days. And you can imagine being an outdoor worker, a farm worker, a construction worker, having to work day after day when it's over 105. And it's really going to be a difficult issue for workers, but kids also spend a lot of time outdoors, and they're playing, or they're doing activities where they're going to increase their minute ventilation, as David pointed out. So they're going to have and they're closer to the ground. So they're going to have increased exposure to both air pollution and heat during those days. And one of the issues with regard to those hot days, it's not just going to be ozone that's an increase, but emissions from power plants when we don't have renewable energy sources will increase particulate matter and oxides of nitrogen. And in California, we're moving towards renewable energy sources. We're supposed to have complete 100% by 2040. We're making good progress in that regard. But right now, we still burn natural gas for energy, and that generates mostly oxides of nitrogen. So where there's red on this map, you can see in California, Central Valley in particular, are the most vulnerable areas with regard to heat, and often the most impacted people in those areas are low-income communities of color who can't necessarily afford air conditioning, like where farm workers and their kids live in pretty poor quality housing in the Central Valley. So another pollutant I've already mentioned is nitrogen dioxide. It's an oxidant gas. It's not as potent by weight as ozone. Comes from combustion of fossil fuels. We live in an atmosphere of 80% nitrogen. So whenever you burn almost anything, you generate oxides of nitrogen. But the biggest source, and these are data from London, but they apply here as well, on-road sources, but then off-road vehicles like agriculture and construction vehicles contribute, over 75% of the total oxides of nitrogen. It's often used as a marker of traffic emissions. And so here I have to mention work by one of the speakers here today, Kiros Bahani, from the landmark Children's Health Study in Southern California, where they studied lung function on an annual basis from age 9 to age 18. Age 18 being important because lungs are mostly developed by then. So decreased lung function growth was shown in association with exposure to nitrogen dioxide. And this slide, from a New England Journal of Medicine article. There aren't that many air pollution studies that get into New England Journal of Medicine, but the Children's Health Study was so important that it got in. It's gotten in several times, actually. And the circles on this slide are not just individual. Each circle represents hundreds of kids, boys in the dark circles, girls in the open ones. And there's been, you can see, as annual exposure to nitrogen dioxide increases on the x-axis, there's decreased development of the lungs manifested by decreased FEV1. And I would just point out the annual average national ambient air quality standard for NO2 is actually off this slide. It's 53 parts per billion. So all the kids in this study were exposed at levels that the annual national ambient air quality standard would allow. And as an aside, because other speakers will talk about asthma, there's NO2 exposure has been associated with exacerbations of asthma in kids and also new onset asthma. The next pollutant, which I've already mentioned, is particulate matter. David mentioned this as well. Unlike ozone and NO2, it's not defined chemically for air quality standards, but as a mixture, by weight. And it's a mixture of combustion particles, which are thought to be the most damaging to health, but also there are sources, natural sources with surface dust, and that surface dust can be contaminated by biological agents such as fungi, pollen, etc. Multiple sources. And I think in the context of this talk and this symposium, it's really, again, combustion of fossil fuels that we're most concerned about. What do we know about particulate matter in terms of health effects? Again, like ozone and NO2, it can exacerbate asthma. It's been associated with new onset asthma, but decreased lung function growth and mortality, especially ischemic heart disease, and then there's lung cancer. And that belching diesel truck, you won't find that in California because we have basically regulated diesel. So there has to be diesel trucks that are out there have to be clean. I wish the federal government would move in the same direction they're starting to. And again, to quote or cite the Children's Health Study that Dr. Burhani was intimately involved in, this is a different type of outcome. Here, as average annual PM 2.5 increases, we have more kids with FEV1s, forced expiratory volume in 1 second, lower than 80% are predicted, which is sort of at the lower limit of normal. And each one of those dots is a different city where the study was done. And again, this is from age 10 to age 18. So wildfires. I think in California, it's been a big issue the last 5 years. Really, 2017 was the first bad year, but 2018 was the most dramatic impact with the Camp Fire up in Butte County, where the town of Paradise was burned. I deliberately show this slide of Paradise, a car and buildings burning, because to remind everybody that when there's a wildfire at the wildland urban interface, it's more than vegetation that's burning. It's man-made materials, which are even more toxic than the already toxic wildfire smoke. And this is a satellite photo showing the plume of smoke coming down from Butte County, sort of filling up the northern part of the Central Valley and then coming out at the bay. And this is 2020, when we had this really horrible month from early August to early September. Every one of those red dots, this is the entire Pacific Northwest. Actually, I think it goes from Mexico up to British Columbia. And every one of those red dots is a wildfire. In Portland, they had air quality like New York City just had, with air quality index over 300. And we had spare the air days from the Bay Area Air Quality Management District for 30 straight days. And September 9th was particularly imprinted in my mind, because that's when the sun looked like Mordor, if you're into Lord of the Rings. So what are the emissions from wildfires? The primary pollutants are on this slide. And you can see that in addition to particulate matter and oxides of nitrogen, carbon monoxide, there are some really nasty compounds like polycyclic aromatic hydrocarbons and volatile organic compounds, which include carcinogens. Basically, I like to think of wildfire smoke as cigarette smoke without the nicotine. It's not bad, by the way. I'm not blowing smoke, no pun intended. But then there's secondary air pollutants. Particulate matter is generated by the oxides of nitrogen that are released. They develop nitrates in the atmosphere, and then ozone is generated by the NO2 that's also increased. And I don't have a slide with regard to the impact of wildfire smoke on lung function growth. Why? Because we don't have kids exposed chronically like we have in Southern California or Mexico City. But we do know a little bit about the respiratory health impacts of wildfire smoke. This is a nice study from Scripps investigators in San Diego. And the San Diego county has a children's health system where they can capture most of the pediatric healthcare utilization. And so they looked from 2011 to 2017 on wildfire specific PM 2.5 versus the usual non-wildfire PM. You can do that by satellite data. And they found that the wildfire specific PM 2.5 was 10 times more potent at causing increased healthcare utilization for respiratory outcomes in kids. I want to end up with household air pollution. I was just in Kenya where I was teaching African physicians clinical research skills, and many of them are very interested in household air pollution. I've done work in Malawi, but this is a photo of a mother and her young infant from Guatemala, the Western Highlands of Guatemala, with a traditional stove. So the child is exposed to whatever the mother is exposed to till the child can walk on his or her own. 40% of the world's population still cooks with solid fuels, especially in rural areas of low-income countries. And it also substantially contributes to outdoor air pollution, including black carbon aerosol, which is a climate-forcing agent. And this is a slide with some results. It was actually the first study that showed some impact of household air pollution on lung development. And basically, we had a statistically significant effect of household air pollution measured by carbon monoxide exposure, direct measurement of carbon monoxide exposure to the infants as they were growing, on peak expiratory flow, but an almost significant impact on FEV1. And there are other studies from Ghana and Malawi that have shown that early childhood exposure may be an important critical window for impacts on lung development. To just remind everybody about household air pollution, which is often biomass smoke that's not much different than wildfire smoke. There's increased risk of pneumonia in young children. That's been pretty conclusively established, potentially decreased growth of lung function in children. But there's also increase of chronic respiratory disease, especially COPD and lung cancer in women who get the most exposure to biomass smoke around the world. Because in low-income countries, women generally don't smoke. And when they get COPD, it's usually due to biomass. So I just would end with wearing my policy hat from the California Air Resources Board. The sources of air pollutants that harm health are the same that emit greenhouse gases and aerosols. And so strong governmental policies are required. We need to move away from burning fossil fuel for transportation and for power generation. Thank you.